everyone, and welcome to another episode of Mental Health Matters with Dr. Matt Gloviak. Today I'm very excited to introduce our guest, somebody who's one of my favorite people who I don't get to see that often, Miss Diana Mondragon. Diana and I have worked together at various capacities. The first time we worked together was at Northern Illinois University. We've done work together at the Illinois Counseling Association with the National Board for Certified Counselors. So lots of different things that we've been doing. And it's my understanding that you're still involved in a lot of work today, correct?
Yes. I'm a school counselor at Dundee Crown High School. It's a school in the suburbs.
Okay.
Specifically, I'm one of the ESL counselors. I'm one of two ESL counselors, so I work a lot with our ESL population, which is English as a second language,
Okay.
or sometimes nowadays it's referred a lot as English language learning, ELL. So I'm involved with that, and through that I am also involved with the parent group that we have called Hablemos, which is like a monthly meeting for our Spanish-speaking families who sometimes miss out on some information, whether it's because they don't have as much, they don't use technology as much, and so we provide a space to give them updates about the school and things like that. I also sponsor Adelante, which is a student club for our Spanish-speaking students. I am on a group that runs like a mental health awareness campaign for our school, and some other things.
I think this is why we don't see each other too often,
I
right?
think so,
You're off
yeah.
doing so many different things. I'm busy here as well, but everything that you're doing here is really great. And I know that this is just one aspect of a lot of the work that you do here, and why we're here today with our topic, to be able to talk about some of the special considerations that we have, working with the Hispanic population and in terms of mental health and everything. So, one of the things I was catching on to you saying here is it sounds like you have some very specific types of groups that you have organized and that you're facilitating, working with the Hispanic population.
Yes. Today, actually, we took a group of ESL juniors and seniors to Loyola University, and some of them, it was their first time even out of Carpentersville, where they live. Some of our students who are juniors and seniors haven't even seen Chicago yet, and they've lived in Illinois their whole life. So little things like that, little exposure opportunities to help students see that there's more out there, and they have there's things that we can work towards, and just giving them those kinds of experiences. And so we do like college visits for our students. We help connect them with professionals in the community. With our parents, sometimes we bring them along to like conferences. So we try to just provide experiences for both the students and the families, as well as provide them with information and resources.
Well, and that's absolutely fantastic. And being able to, like you said, we live next to a huge city like Chicago, a cultural melting pot, so many different things to offer. But even people viewing the show right now in Bolingbrook, Illinois, brag about being 25 miles away from the city. However, how many people have never even had the opportunity to go out there? Right. So it's really fantastic that you're taking them to see some of the different sites. The more exposure they have to different things in the area, the more opportunities that they can have. So taking a look at some of the things that we were saying here as well, talking about ESL, so English is a second language. One of the things that we have to consider while working with the Hispanic population is that for many individuals, English may not be a first language, and for many individuals who are living out here as well might not speak English at all. How do you see that impacting the Hispanic population?
It's definitely a barrier when it comes to like different school events. So for our ESL 1 and 2 students, who like are students who are brand new to the country, who are barely like learning English, we unfortunately at our open house we didn't see a lot of those families come in, and I think it's because they can't speak to the teacher, like they can't ask questions. So something that the school started doing last year is providing translators, so that they can, like when they make an appointment with the teacher during like parent-teacher conferences or events like that, that like one of the translators or someone that speaks Spanish in the building can help have like that meeting between the parent and the teacher. But it's definitely a barrier. As far as also like I said, like sometimes they get phone calls home, whether it's like your kid's in the nurse's office or is missing school, or things like that, and they don't answer those phone calls because they know that they're not going to be able to speak to the person on the other line. So it's definitely a barrier not being able to speak the language. But I think my school has done a fairly good job at trying to help overcome that barrier for our families.
Well, it certainly sounds like that, and that's why, again, I'm so pleased to have you here to be able to talk about this. And we really do have to think about that because language is a significant means of communication that we have. We talk about, interpersonal relationships and how important they are, and a big piece of that is to be able to communicate effectively with one another. And if we're not on the same page, it can make a lot of room for misunderstanding, can lead toward frustration, missed opportunities, and so on. I'm kind of laughing a little bit, even in the back of my head. I'm thinking about a lot of the classes that we have here. We know the school curriculum has continued to become more and more challenging as time has gone on. I'm thinking about people where English is a first language are struggling in their English class. We're trying to read these big books, and now we have somebody who, either speaks limited English, English is a second language. How can you really go and understand what it is that you're reading and be able to comprehend it at a level that we're trying to have? And I know that's been a big problem, especially if we take a look at mental health psychology historically. We've based a lot of intelligence exams and that off the English language in some of the English speaking populations, predominantly white populations, and it's a pretty significant disadvantage to Hispanic individuals, I would think.
Yeah.
So as you put together these different programs with ESL, like what are some of the things that you focus on to be able to assist, like through some of these challenges?
So something that we're doing this year too is running a newcomer group, like helping the students also just become adjusted to their new home. Like there's cultural differences as far as things that might be appropriate in different cultures and things that are appropriate here. So helping them just learn the norms of what it's like to be here in America. So helping them make that transition. We translated a behavior expectations presentation. So every year the administrators put like this big video together about rules and expectations, and
sure,
if
the
you
kids
don't
love that,
understand,
right?
Yeah, right. And if you don't understand, like if you can't understand what they're saying in the video, how do you know to not have your hat on, or how do you know to that tardies will result in detentions and things like that. So just trying to find small things, small changes that are doable that we can do to help the students.
No, absolutely, and that's one of the things too that I really appreciate you stating here in terms of the language barriers that we can have. So not only is it hard to be able to assess an actual intelligence level when somebody doesn't speak English as a first language and can't necessarily understand the material because the language doesn't make any sense, but now we're taking a look at things that can actually result in disciplinary action because they don't understand not to wear a hat in school or chew gum or carry a phone and these different types of things. So now we could see some children who are well-intended getting into trouble for something they don't understand, and that's a huge disadvantage.
Right. Yeah. So we hoping that's. I can't think of any student that's gotten in trouble, for anything like that.
Well, that's good.
Yeah, so I don't know if it's all attributed to that, but I think it helps that they at least had the same information presented to them as the other students.
Well, I think a big thing that helps as well is from the very beginning of this, you're talking about all the different programs you have specifically catering to the population. My understanding is that there's many schools throughout the country that actually don't have these types of programs. So it's really great to see here at the school that you're at, in Dundee, they're actually taking initiative to be able to assist, whereas some other places in the country we don't always see that. And speaking about Bolingbrook, Illinois, we have to take a look at our Hispanic population is in the area of about 25.9%, so a fairly significant part of the population. And over time, we've continued to adapt culturally. There's many more restaurants now that have individuals speaking Spanish. We see a lot of different, Hispanic-oriented restaurants, grocery stores, and so on that have been here in Bolingbrook, and it's really great. However, there's still a lot of places throughout the country that really need to get caught up here. In terms of cultural differentiation, what do you think are some of the biggest cultural differences that whether personally or professionally, as compared to maybe somebody who was, grown up as an American?
So actually the reason why I got into counseling is because, at least when I was growing up, I think it's gotten better, thankfully, but when I was growing up, mental health wasn't really something that was talked about in the Latino Hispanic community. You're feeling sad, you're feeling down, it's like go to church, pray it off, things like that. I remember my parents just not like really necessarily understanding like what anxiety and depression was. And it's not that they didn't want to like help me through it. It's just they culturally they didn't grow up with that, and they grew up like living hard lives. So to them, they're thinking, you know, like, well, you have everything you need here. You have such a good life here. Why are you depressed? And so I think like that's why I got into counseling and mental health, is because I want to help educate the Latino community that mental health is important and it's real, and depression and anxiety, they're normal things when they're, you know, not debilitating or not keeping you from enjoying life. But when it gets to that point, you need some help. And that's why I wanted to be a counselor, is to help people, students like me, when, you know, where I was, and to help educate parents, give them information on how to help their child.
Well, that's certainly something great that you're doing here as well. And we know, the United States as a whole, over the last decade or so, and it's been going on well longer than a decade, but over the last decade, we've really had a huge push for mental health awareness. We take a look at May, we have Mental Health Awareness Month, and every single month there's a different, type of topic that we're focused on here. And so we're trying to destigmatize the stigma of, of mental health here. However, culturally, the way that we see things can be a little bit different. Because my understanding is within the Hispanic community, especially within the families, that it's taboo to talk about the family outside of the family. So if I were to have, let's say a son come in and talk about his parents, to a counselor, like that would be something that's frowned upon, stepping outside of the family. Is that true, or?
I think, I mean, I don't want to, overgeneralize, but yeah, I do think it is kind of like you keep things, your business within the family. Also, like I've seen parents who do have like children who are hospitalized not necessarily like want to tell other family members or want it to be known, because unfortunately there is still that stigma of like, oh, well, am I crazy? If I'm seeing a therapist, I must be crazy. If my child is in the hospital, they must be crazy. So yeah, I think yeah.
Well, it makes it hard, and the other part of it too that I know is, we take a look at, people who are therapists, and it can be difficult to be able to go and see a therapist who's outside of your own culture. Like, what's this individual's, intention coming into this? I know, especially being, that stereotypical white 36-year-old male, sometimes when I have clients come in from a different culture, not just the Hispanic community, it could be African American, anybody else, kind of coming in, well, what is this man's intention? He's educated, but does he really care about me? Is he truly going to get me? And, be able to relate to me on this type of level. And one of the things that we do see as well is that, with, becoming a therapist does require a lot of education. You have your bachelor's degree, your graduate degree, and a lot of that, we do see with some of like the upper, middle to upper class populations, a lot more like the white folks and things like that. So how do you think it resonates differently to be able to have somebody of Hispanic culture working with somebody in the therapeutic setting?
I think it matters a lot, and I see it in the school too. I adopt students, like students that aren't necessarily mine, but I look like them and I can relate to them. And our counselors are fantastic. Like, I'm not trying to say that that's why they're coming to me, but it's just a matter of like, well, you grew up with Hispanic parents. You know what it's like to not be able to go to sleepovers or to have like really strict.
Not go to sleepovers? Yeah. Oh, come on.
Yeah.
One of my favorite things growing up.
And yeah, I hear that all the time. Like, the students are like, my parents don't let me do anything, So I do think the representation does matter, and that it is important for the students. I think they're just like naturally, they're like, oh, I think I can relate to you. So yeah, I see it a lot.
Well, absolutely. And then the other part of it too is, language is significant. There are certain words in certain languages that don't translate over 100%. And when we talk about one's emotional experience, the things that we feel, generally, we feel things in relationship to the words we have to describe them. So if we can't put into words, especially those we don't understand, so if English is the second language, Spanish is the primary language, it might be quite challenging to actually go through an entire counseling session trying to speak a language that's not primarily the way that you think. And I know for many people, if English is a second language, even though you're speaking English, you're thinking in
Yeah.
Spanish and kind of translating in your head the entire
Mhm.
time. I'm wondering, like, so in your experience working, with different students of that, do you find yourself speaking, more Spanish, more English, mix of both?
It's definitely a mixture of both because we do have, so we have our newcomers that are new to the country, but then we also have the ESL students that have been in the ESL program pretty much their whole educational life that speak perfectly good English,
Hmm.
but they still receive ESL services. So it's definitely a mixture of both because although the students might have perfect English, like their parents are still primarily Spanish speaking. So like last Friday, we actually had an Hablemos meeting where we presented about mental health and had an awesome presentation. We got great feedback, but like I spoke so much Spanish that day that like I went home and I was still speaking Spanish. So it's a mixture of both, but yeah, I think that's a good thing though to be bilingual and to be able to think in both languages sometimes.
Absolutely. My Spanish is absolutely terrible. Que es horrible. Not good. Yeah, but so what do you think are some additional considerations we need to make while working with the Hispanic population in terms of, like any needs that you see through a needs assessment, some things we could still be doing a better job with?
Besides, the language barrier that's there, again, like I think helping raise awareness to what mental health is, and more focus also just on access to different services, like access to mental health services, access to college visits, just
Absolutely.
access to things is limited for some families for different reasons. Sometimes it's not always language, sometimes, a lot of the times, unfortunately. So like my school is 56, 57% Hispanic,
Okay.
and about, I want to say like 40, maybe even 50% low income.
Okay.
And unfortunately, the two kind of go hand in hand because if you don't know how to speak a language, like you have limited job opportunities. So sometimes, like students are working jobs to help provide at home. So there's a lot. There's a lot that goes into it besides just language barrier. There's other like little things that play into it, things that we should consider.
Well, I know one thing that's been a major topic, and this is a difficult one certainly to talk about, and I don't want to jump on a political bandwagon or anything like that. But a lot of concerns of what's going on in the United States in terms of discrimination. When I say Hispanics, thinking more so about Mexicans specifically, Mexico putting up walls, concerns about deportation, ICE, and what's really happening with a lot of these adolescents and that is their parents may have not gone through the appropriate channels to become American citizens, and they get deported, and then now the children have found out not to be American citizens, and now they can face deportation. And many of them, we see it all the time in different social media, in the news and so on. Students are graduating high school, college, getting great jobs, doing wonderful things, and then now all of a sudden, everything goes at risk for something that was outside of their control. Like, do you see a lot of that happening in this area? I know it seems like there's a lot of focus, especially around the border areas. We talk about Texas, California, and so on. Here we are in Illinois, in the Midwest. Do you have a lot of concern with that out here? Because I'm thinking, it still is a major concern out here.
It is, and I do have students that had parents that were not born here, but maybe they were born here, and I do have students that weren't born here either, but don't find out until they get into high school and you're applying for a driver's license or a job, and like then you find out that you weren't born here and you have certain limitations, and it does. I think, I know it does affect students. One of my students recently graduated from our Success Academy, and she started crying, like in her portfolio presentation, saying like, well, I don't know what I'm going to do because I wasn't born here and I don't think I can go to college. They can absolutely go to college, and it breaks my heart that some students that weren't born here are getting the message that they don't belong in college, that they can't make it to college, because they absolutely can. There's so many colleges that have opportunities, scholarships, homes for students, who weren't necessarily born here.
And that's where I think the awareness is especially important, because when you grow up or you suddenly realize that, okay, I'm in this compromising situation, there may not be opportunities for me, and that can really throw somebody into a tailspin. Here we have somebody who was a great student, worked hard all these years, seems as though any opportunity I want in life is going to be available to me. Now all of a sudden, it's all at risk, so what do I do? One of the things that we talk about here as well is I really tried to make this push with Mental Health Matters to focus on mental wellness and instead of so much mental illness. You know, we sit here and we take a look at mental illness, you know, being a pathology, it's a bad thing, it's something you're afflicted with. However, I see so often in life, based off different environmental factors, things that are going on in society, where people are having adverse reactions, which I believe are normal, you know, based off something extreme going on. So let's say somebody in this type of situation feeling extremely anxious or feeling depressed, having a hard time sleeping at night, feeling paranoid, worrying that the next knock on the door can be somebody asking questions and, you know, removing them from the house and so on. You know, these are normal reactions, you know, to something very extreme. You know, so how do you see like this type of situation tying into mental health as we see it?
Well, I think actually today I had one of my colleagues was sharing a story about one of her students who was saying that she had a hard day today because her mom, or there were ICE agents at the Walmart nearby recently, and her mom has pretty much been staying at home since they saw that because she is afraid, and the student was just thinking about it all day today. And so I do think that that fear of just you don't know what can happen does affect the student's mental health and the parents' mental health too. Like just, you know, you're walking down the street and you never know who's gonna ask you questions or who's gonna stop you. So yeah, it definitely affects both.
We're being treated like a criminal for doing absolutely nothing wrong. And, you know, when we have something, you know, going on in somebody's mind, having that constant fear, the worry that the worst can happen at any moment, I mean, that's going to distract you. It's going to make it harder to perform at work, to perform at school, to engage with other people appropriately. And then the other thing it does is it does create some animosity toward the people who are marginalizing you like that. And so a lot of problems come out of this. You know, another thing we were talking about earlier that I'd like to, you know, put some focus on is Latinx. Would you mind describing what Latinx is and the Latinx movement?
Yeah, so you might have noticed that I'm saying Latino or Hispanic, and that's just because I'm culturally, like, that's kind of like, I identify as Latina because I'm very proud to be a woman, and there are gender aspects to being a female Mexican. So like, so that's why I choose to use the word Latina and Latino, but I know that there's this movement to move towards Latinx, and that's because to make it more of gender neutral for maybe some people that don't identify as female or male, or to just make it more inclusive because Latino is more, it implies like it's everybody, but it's a male pronoun.
Oh, absolutely.
So even though like you can generalize and say Latinos, and it's including both men and women, by saying Latinx, it's everybody. Like there's men aren't necessarily more important than than females or than those that don't identify. So that's where that movement's coming from, is just to make it more inclusive.
Well, and like having this level of inclusivity as well is something that we've really seen a lot, you know, throughout the United States, trying to, you know, include everybody, whether, you know, identify as male, female, you know, somewhere in between, and that, so making a big push here. I'm curious, so with everything that's going on, you know, when we talk about LGBTQI plus going on, how do you think like that type of, you know, sexual identification, sexual orientation, how does that impact the Latino population?
Again, like I don't want to overgeneralize, but I know that at least from like my experience and the students that I've worked with that are part of that community, haven't come out to family or are, you know, struggling with coming out because it's frowned upon in the community. It's seen as something that's wrong. So I think that, especially also if you're combining, you know, all the things that are kind of playing into mental health for Latino students, if they also identify as LGBTQ or anywhere within that community, it's another added layer of stress because you can't be yourself to your own family. The people that are supposed to love you and accept you.
Yeah, you stated that quite eloquently, and that's true. And then the other thing that we see here as well, and while I do believe that, you know, as a nation, despite a lot of the things going on, I feel that we have become much more open-minded, more inclusive. Again, a lot of work that we need to do. However, you know, with some of our marginalized populations, and unfortunately, you know, with what's going on, the Hispanic population being one of them, then also having that going on as well. Now we almost have this dual type of discrimination. So not only are, you know, people outside of the culture, you know, looking down in these two ways, but then we also have people within the culture also looking down. And, you know, this type of dual discrimination discrimination can make it really hard for a person to be able to self-identify, have high self-esteem, be confident, and be able to just really be who they're meant to be.
Yeah, especially young people. Like as you're trying to just figure yourself out, and then you have all these other things that you're trying to navigate and figure out. Yeah.
Well, what do you think, what would be some of the best recommendations that you would have for somebody who's not, part of, Latinx community to be able to work with someone within the population? Any recommendations you might have?
I think just addressing the elephant in the room and saying like I know that we come from different cultures, and I guess I'm speaking more like someone who's a helping professional.
First thing I teach my students in their master's counseling classes is this is how we culturally identify, make sure that we do discuss it 'cause it's an important part.
Yes. So I have a therapist actually, and that's one of the things that she brought up once. She was like, if I ever say anything that is offensive, or like if I ever just say anything that feels wrong to you, please let me know. Like I won't be offended by it at all. Like I'm here for you, and we're here to work together. So I think like just being open, being willing to take maybe some feedback if you do step something.
Oh, absolutely.
Yeah, just addressing it and keeping an open mind, and keeping things in mind like some of the barriers.
Oh, absolutely. And it's so important to be able to have those types of conversations about it. Now, even this conversation we're having right now, there's been various parts. It can be a little bit, uncomfortable talking about, some of the discrimination we see, some of the lack of opportunities, talking about deportation and these types of issues. But they are issues that we need to talk about, because if we don't talk about them, there's not going to be the level of awareness we need. We're not going to have enough people being able to advocate to help, get to a better place and eradicate this type of discrimination like we need. And I think a very important thing, especially for anybody in the country, but specific to the viewers who are here in this area, Bolingbrook and surrounding suburbs here in Chicago, is that these issues are real. They're real for us right here in this area. It's not something that's along the borders, but something that we need to be addressing here.
Yeah, that's absolutely right. Like you mentioned, Bolingbrook has a high Hispanic population. Aurora is another high. Chicago, like everywhere, especially in this area, there's a high population, and yeah, what can we be doing as a community to include everybody?
Oh, absolutely. And the thing that we really need to be doing is working together to make sure that we get on the same page with these things here and everything. Another thing too that we really have to consider here as well as we talk about, equality versus equity. So equality, everybody having the same exact opportunities. Equity is going through and being able to balance things out so that people who may have certain advantages, certain disadvantages, certain privileges, certain lack of privileges, so we can try to keep everything here, along, the same lines, so people have these equal opportunities, such as, like we said, going to college, getting appropriate jobs, feeling comfortable, being able to go outside of their home. And like, what types of things do you think that we're doing in the schools, that lead toward that? And I know some of the programs that you mentioned, like Hablamos and so on. Hope I said that right.
Hablamos.
Hablamos.
That's okay.
I apologize.
You let me know that your Spanish was
it was terrible.
It
was terrible. It's been years.
Yeah, things like that, like the programming, definitely creating a space for people like parents. By law, every school needs to have a bilingual parental advisory committee, every district.
Okay.
So like making sure that those are active and doing important things in the schools. And then, like I said, little things just like translating presentations. If there's phone calls home, make a phone call home in Spanish and in English, or like a recording in English and follow it up with a recording in Spanish. There's a lot of simple things that can be done to help level out that playing field.
Excellent. Well, thank you so much for your time here today and talking about the Hispanic population. This is just a small amount of many of the different things that we could have been talking about here. So this was by no means all comprehensive and did just scratch the surface. However, we do need to make sure that we are considering different cultures and their specific needs. If you have questions, ask them. Let's make sure that we're speaking with one another. But with that, thank you once again for tuning in to Mental Health Matters with Dr. Matt Gloviak and our guest, Diana Mondragon. If you want to be a guest on the show, you have any questions, comments, or other type of feedback, please feel free to reach out to me at dr.mgloviak@gmail.com or come and check in the Facebook website. Thank you very much.